Hi, my name is Kirsten Shaw, and I'm one of the cardiology fellows here at Minneapolis Heart Institute. Today, I'm going to talk about an interesting topic, which is what can we learn from Hollywood heart attacks? And specifically, this means what can we learn from the way that heart attacks are shown in the movies? So Hollywood loves putting a good heart attack scene in the movies, and you probably know the scene. You've seen this before. Someone grabs their chest in the middle of an argument, they collapse dramatically, and they die in seconds. And it's gripping, and it's dramatic, and it's tragic, and unfortunately, it's mostly wrong. So while these dramatic presentations make for great entertainment, I'm here to tell you today that these portrayals aren't just inaccurate, but they're actually a little bit dangerous because whether we like it or not, the average US adult gets a lot of their health education and health information from popular media. So, what you see in movies over and over and over again, odds are that you're going to start to think that that's true. And in this case, the concern is that people are learning incorrect information about heart attacks by watching these scenes, which are not always very accurately portrayed. So many studies have shown us the effect of mass media on the public's understanding of health. Popular media narratives, whether through social media, film, TV, can have significant influence on our understanding of health. In fact, there was a 2003 survey done by the American Heart Association that showed 45% of women at that time, way back in 2003, were receiving their heart disease information from magazines. And my question to you is, what would that survey show today? Well, we all know the answer. The majority of people in the United States are getting their health information and their heart disease information from social media, popular media, especially given the massive escalation of availability of these resources over the past 2 decades. And you see headlines in the news that highlight the impact that popular media has on our understanding of health all the time. Here's just a couple examples of some recent headlines in the news. 89% of US citizens turn to Google before their doctor. How the TV show ER taught thousands of viewers about cervical cancer, and that TV show episode actually increased cervical cancer screening rates for a population. 33% of Gen Zers trust TikTok more than doctors, new survey shows. So, like it or not, popular media, social media, they're probably here to stay. So, I set out to investigate how popular film portrays heart attacks. And this was my attempt to understand what false information may be unknowingly being spread from these portrayals of heart attacks in films, just so we as cardiologists know the gaps where we need to provide more education to our patients and the public in general. So, today, we're going to separate some fiction from fact, and we're going to debunk some harmful myths, and we're going to give you the tools to recognize a more real life version of a heart attack. We have four main topics we're going to cover today. We're going to talk about how heart attacks are portrayed in film. We're going to talk about who gets heart attacks in film, and we're going to talk about how many people die from their heart attack in film. We'll then show you the reality of those questions as well in real life, what happens. We're also going to, at the very end, briefly talk about preventative tools to help keep our hearts healthy. So as I said, I recently led a study to investigate this exact question, and our paper was published last year in the Journal of the American Heart Association. What we did was we watched 100 of the most popular films that featured a scene of someone having a heart attack. We analyzed their symptoms, and we used film and script data to understand gender and race ethnicity of the affected people. Our paper showed just how inaccurate some of the depictions of heart attacks can be in film and how misrepresentative they are of who actually gets heart attacks. And so this paper picked up a lot of interest from the public, and the American Heart Association ended up doing a feature piece about our article, which then got picked up by several different news outlets. And it was fun to watch this all kind of unfold. And ultimately, I think now it's been picked up by 40 different news outlets, and they've had stories about it. And I think the reason that people have been so interested in this paper is really because it's very relatable. We've all seen these movies that feature heart attack scenes. Think about The Godfather or Meet Joe Black or Something's Gotta Give with Jack Nicholson. It's fun to think about the implications of these scenes that you've seen several times. So let's get to our first question here. How are heart attacks portrayed in film? So after watching these 100 movie scenes featuring heart attacks, the most common presentation of heart attacks in film was actually something that very rarely occurs in real life, and it was falling. 88% of men in the films fell to the ground. 100% of women fell to the ground. So every woman in these films who had a heart attack fell down to the ground at the time of that. It's not a common or typical presentation. Interestingly, the fall was usually accompanied by the second most common presentation of a heart attack in film, which was a loss of consciousness. 68% of the men had a loss of consciousness, and 80% of the women did. The interesting thing about this coupling of these two presentations together was they were usually getting at sudden death. So people would have their heart attack, fall to the ground, and die. These percents of like 68 to 100% are so much higher than the real life data. When you look at how many people truly would pass away from a heart attack, the real life data is only about 12% of people. So this is just greatly over dramatized. The third most common presentation of a heart attack in film was chest pain. 67% of men, 50% of the women had chest pain in these presentations in film. In real life, this is the most common presentation of a heart attack. And in real life, we think it's maybe even up to 90% of men and women will have chest pain at the time of their heart attack. And then the fourth and my favorite presentation of heart attack in film was screaming. So 29% of men, 40% of women actually screamed, yelled out, or shouting at the time of their heart attack. This is something that many of us have seen maybe once or twice. I've asked some of my colleagues who've worked in cardiology for 40 plus years, and they've seen one or two people screaming at the time of their heart attack. This is a less than 1% of the time situation, though, so very over dramatized again. So just to summarize this in film, almost everyone has acute onset, chest clutching, falling to the ground, often dying presentations of a heart attack. In reality, death from a heart attack only occurs in about 12% of cases, and all of these just show us how overdramatized this presentation in film can be. In reality, symptoms of a heart attack are often much more subtle. So this is a pictorial from the American Heart Association, and it just shows the common heart attack symptoms. And this is real life. It's pain or discomfort in the chest. It's lightheadedness, nausea, vomiting, jaw, neck, or back pain, discomfort or pain in the arm or shoulder, and shortness of breath. So the reality is that the symptoms of a heart attack are much less dramatic than they're often shown in film. So if we were to rearrange this and make this a little bit closer to reality, we would get rid of the falling, we'd get rid of the loss of consciousness, we'd get rid of the screaming, we'd make chest pain that number one most common presentation of a heart attack. We'd circle that and we'd star it because that's the main thing people are experiencing before a heart attack for both men and women. So then we'll move on to our next section, who gets heart attacks in film? So if you look at this graph, every triangle here shown represents one of the 100 film scenes featuring a heart attack that we reviewed. So there's 100 triangles on this graph here. If you look at the top, this blue shade area, all of these triangles represent a man was shown in the scene having a heart attack or was the one having the heart attack. If it's in this pink section down here, the person having the heart attack in the film was a woman. You can immediately see there's a lot more triangles in the man side than the woman's side. And that was true. Of the 100 scenes, 90 of them showed a man, 10 of them showed a woman. So that was 90% to 10%. In reality, of the 800,000 some heart attacks that occur every year, it's about 50% men and 50% women affected. Men do have a little bit more heart attacks every year than women, but we're talking about a couple of percentage point differences, nothing quite as marked as this 90% to 10%. We then looked at race and ethnicity here as well. And what you can see is that every triangle that's blue represents a white individual, yellow is Hispanic or Latino, Latina, green is Asian, and orange is a Black or African American. Of the men, 90 men, 5 were non-white. Of the women, 1 was non-white. There were no Black women represented in these films of heart attacks. So overall, in film, we have racial and ethnic minority populations being underrepresented when in reality, they're disproportionately affected by heart disease. We also have women underrepresented when in reality, women are affected by heart disease just as much as men are. This portrayal of heart attacks as predominantly affecting men is also interesting for a couple other reasons, which is that society has historically sort of shown heart disease as a man's disease more than a woman's disease in the past as well. And we can see that in this survey, reflected in the survey from Circulation back in 2000, where they asked women, what is the leading cause of death in women? And just to see if women's awareness was there. And the survey results from 2009 showed that 65% of women recognized that heart disease was the leading killer of women. They redid the survey 10 years later in 2019 after multiple awareness campaigns had started to raise awareness in women that heart disease affected women as well. And actually 10 years later in 2019, the awareness that heart disease was the leading cause of death in women dropped to 44%. A lot of women think that cancer is a leading cause of death of women, especially breast cancer. The truth is that heart disease kills more women every year than all different types of cancer combined. So, for some reason, awareness among women that they're affected by heart disease is lacking. And perhaps in part that's because of the popular media representation that we're even seeing in this study that tends to show heart disease as predominantly a disease that affects men. So now that you know this, if you keep an eye out for evidence that our society just tends to portray heart disease as more of a man's disease, you'll see it everywhere. For example, when I Googled heart attack last year and looked at the images, you can see it just predominantly shows white men having heart attacks. Thankfully, we have one woman here to represent the women population. But the take home message from all of this is don't fall for the Hollywood script. And it's important to understand that both men and women are affected by heart disease and have heart attacks. And it's important to know that racial and ethnic minority populations are disproportionately affected by heart disease and are at risk for heart disease and heart attacks. So tell your friends, tell your family, these groups get heart disease too. So let's move on to the third category here. How many people die from their heart attack in film? We're going to do a comparison here between film and reality. So when we look at the data about fatal heart attacks, first of all, we can remember about 800,000 people a year are having a heart attack. Of those 800,000 people, in reality, about 12% of heart attacks are fatal, meaning that people die from their heart attack. When we looked in film, 62% of the heart attacks in film were fatal. And when we broke that down by gender, 59% were fatal for the men. 90% of the women died from their heart attack in film. This is just markedly higher than it is in reality. So then when we looked at cardiac arrest at the time of heart attack, and cardiac arrest is when in the setting of your heart attack, your heart goes into a dangerous rhythm, and it is something that can cause sudden cardiac death at the time of your heart attack. In reality, only 4 to 12% of heart attacks are complicated by a cardiac arrest. In our film study, 43% of individuals had a cardiac arrest at the time of their heart attack. Again, just exaggerated and over dramatized. So all of this really to say that in movies, if someone has a heart attack, they almost always die from their heart attack. And we get it, right? It makes sense. It doesn't make a very interesting movie to have someone have some moderate chest pressure, some shortness of breath, call 911, go to the hospital, get a stent and the right medicines, and go home safe the next day. That doesn't make for very good TV. But this perception that heart attacks are immediately fatal has really spread throughout society because many people think that you don't survive heart attacks. And they think that if you've had a heart attack, you die right away. And this just isn't the case. The truth is that if you seek early treatment, you receive medical care promptly, your odds of surviving a heart attack is actually pretty high. So again, if you act quickly, you seek prompt medical attention, your odds of surviving a heart attack are relatively high. But if you're waiting until you're clutching your chest and falling to the floor like in Hollywood, you might be a little bit too late. So the final takeaway today, I want to talk briefly about some of these preventative tools that we have. And these are things that can just help us assess our risk for heart disease and keep us healthy too. One of the things we use a lot is a calcium score. This is just a short CT scan, cost-effective, low radiation dose that takes a CT specifically of the coronary arteries in your heart. It gives us a really good assessment of how much calcified plaque you have in your heart arteries, and we can catch heart disease before it gets bad enough to cause symptoms or cause a heart attack. This is a really helpful test, especially for folks around age 50 or beyond, if they want to be proactive about their heart health. Blood pressure screenings regularly, cholesterol screenings regularly. All of this falls under these regular checkups that you have with your primary care doctor or a physician that you trust, where they can check your blood pressure, check your cholesterol. And again, we can manage all of these things early before they cause a problem. Lifestyle changes is the other thing to always keep in mind. The American Heart Association has come up with Life's Essential 8, which are their key measures for improving and maintaining cardiovascular health and lowering risk for heart disease. The important things that we know matter for your heart from data and literature and research are eating better, being active, no smoking, get good sleep, manage your weight, controlling your cholesterol, your blood sugars, your blood pressure. All those things have a big impact on your heart and your heart health. And the American Heart Association, again, has excellent resources available for people to read more about each one of these measures and what they can do to optimize themselves in that area. So if you've gotten all your health information from film and you never saw this talk, you might think this is what a heart attack looks like. A white man falling to the ground and dying in seconds. But now that you've been to this talk, you know the more accurate way a heart attack can present is a middle-aged woman who woke up with chest pressure. It's not getting better. She thought it might be GI and took a Tums. Now she's getting some nausea, maybe some lightheadedness. She calls 911, gets really rapid medical treatment and medical care, and is able to treat her heart attack. Or another realistic presentation might be a busy working middle-aged man who starts getting left jaw pain at work and it's radiating to his left shoulder. He's short of breath, something's off. He calls 911 and goes to the emergency department for management. These are real heart attacks. So, to summarize, what can we learn from the Hollywood heart attack? The first thing is that symptoms of heart attacks are over dramatized in film. In real life, the symptoms can be milder, subtle, dull chest pain, chest pressure, nausea, shortness of breath. It's not just that dramatic chest clutching, dropping to the ground, screaming scenes that we see on screen. The second thing is that women and ethnic and racial minority populations get heart attacks too. Films often leave them out, but heart disease is the leading cause of death in all these groups. Most heart attacks aren't instantly fatal. This is a really important take home message. Movies suggest otherwise, but in reality, you have time to get help. If you think you're having a heart attack, call 911, and early treatment saves lives and gives you better outcome. Thank you all so much.
All right. Well, thank you, Dr. Shah, for your time and expertise during today's On the Pulse session. Fantastic presentation. And hello, everyone. My name is John Rickert, and I'm the Digital Education Program Manager here at the Minneapolis Heart Institute Foundation, and we'll be just jumping on here to help facilitate the Q&A portion. Please know that the questions that we have prepared for today were all submitted prior via the registration process and other outlets. So thank you to our registrants who did submit a question. However, please feel free to add additional questions using the Q&A pod, which is located at the bottom of your Zoom screen, as these questions may be addressed in future On the Pulse sessions. So, Dr. Shah, the first question that we have from the audience is, what piqued your interest in this area of research, and why did you choose to pursue this?
Yeah, that's a fun question. Right after I got accepted into cardiology fellowship, I was watching that movie, The Proposal, with Sandra Bullock and Betty White. And in that film, Betty White is having a heart attack. And I remember thinking, wow, I think it's the first time I've ever seen a woman in a movie having a heart attack. It's always men. And then in the movie, it turns out Betty White is faking the heart attack, and it's a very elaborate mastermind Betty White plan. But it really got me thinking about that, and I wondered if I could study that. Could I find films and see if men are overrepresented as having heart attacks in film, and perhaps that is playing into this, you know, societal perception that heart disease is a man's problem, not a woman's problem. And, using the International Movie Database, we were able to find heart attack scenes in the most popular films. And so it was a fun progression to that point.
Yeah, absolutely. And thank you for that. And a question that I had as you were saying that is, what was the most surprising bit of research that you came across as you went through this?
The most surprise, well, this might not answer that question, but the most surprising thing to me was because it's sort of a funny idea to study this. It's not the typical medical journal article you'll run into. But every cardiologist here at MHI that I ran this idea by or asked about it, they were all so supportive. They were all like, that is so interesting. We have to dive into that, and it's these people I've looked up to for years. They're my greatest mentors, and have published thousands of articles on brilliant topics. And I thought this was such a funny one. And they were all so supportive and thought it would be such an interesting thing to get to the bottom of. So it was the most surprising thing to me, I think.
Yeah, well, it's a very interesting topic, and I think our audience will agree with that. So let's see. We have a question from Jessica, and she is asking, what do you wish women of all ages knew about heart disease?
Yeah, that's a good question. I think the number one thing is pretty simple, and it's just that women get heart disease too. And the history of how we studied heart disease is so interesting because, it was the 1940s after World War II that men came back from war and were dying from heart disease. And so we started studying heart disease in men in the 1940s. It wasn't till decades and decades later that we started studying heart disease in women too. So we're just behind on raising awareness that women also present with heart disease.
Absolutely. So the next question we have comes from Rahila, and she is asking, what recommendations do you have for the prevention of sudden heart attacks specifically?
That's a good question. Heart health is so tricky, right? Because it is asymptomatic oftentimes until it suddenly causes a problem one day. So this is where multiple visits with your primary care doctor or a physician you trust over many years, that's why you get your blood pressure checked every time you go to the doctor. All these little visits where you're getting your blood pressure checked, your cholesterol checked, all those little tests we do, it's really a way of monitoring your heart too. So I think my biggest recommendation is just have those appointments, those annual physicals, get your blood pressure, your labs checked. That's kind of the easiest way to detect something early that may turn into something worse or bigger later. If you're over the age of 50, a calcium score, if you are personally interested in your own cardiovascular risk profile, a calcium score is an amazing tool to really understand your personal risk as well.
Yeah, absolutely. And thank you very much for that insight. So the next question we have comes from Larry, and he's got a comment and then a question. So his comment is, unfortunately, not every movie production company can afford to hire a competent medical subject matter expert to see that heart attack scenes appear real. And the question is, what do you believe can be done to make movies that are more accurate and realistic?
That's a great question. So from this paper being published, I have had the fortunate opportunity to talk to a couple of companies that consult on film projects and things. And there are so many options, including a lot of nonprofits that do free consultation services for this. So you can have a cardiologist review your movie script and tell you how accurate it is, or you can have one on set with you the day you're filming that scene. Um, but there are also many services that do, as you're alluding to, Larry, charge a lot of money for that service. So it's a great point. If you wanted to do your own research, I think just making sure you use reputable resources like the AHA or Cleveland Clinic, Mayo Clinic, MHI. All those places have good patient-centric information, I think, to help build that accurate portrayal. Um, and at the same time, one of the things we talked about in this project quite a bit was, we're not asking the film industry necessarily to change how they portray heart attacks because it is an art form and people are going to portray the picture how they need to for the film, and that is expected. So, um, there's so many other directions I want to go with this kind of to your point, which is maybe at the end of films, there's just a tagline that says, if you are having any of these symptoms, these are symptoms of a heart attack or heart disease, and you should talk to your doctor about them. Something like that to just provide that little bit of education if there was a heart attack in the film.
Definitely, definitely agreed. So let's see here. We just have a few more, and I know we are coming up on time here, so I appreciate your time, Dr. Shaw. The next audience submitted question is, what are some subtle or less dramatic warning signs of a heart attack that people should watch for, specifically in women?
Yeah, great question. The main things to look for is that pictorial in the talk where we showed those common symptoms of a heart attack. Those would be the things to watch out for. I would add that, to your point, the more subtle things, if you're usually able to mow your lawn in one go with your push mower and now you're stopping every 15 minutes to catch your breath and then you're going again, or any activity, you can usually walk 4 blocks. Now you can only walk 1 block. Or every time you play basketball with your son, you're getting jaw pain that goes away with rest and comes back with activity. Things like that that change with exertion. That's the time to be thinking about your heart and talk to your doctor.
Certainly. So let's see here. I know this next question you certainly touched on, but if there's anything you'd like to add, the question is, how survivable are heart attacks today, and how does this compare to the fatalistic narrative often seen in movies?
That is a great question. Yeah, and exactly what we talked about. That's the real life, about a 12% mortality for a heart attack, and in film, so much higher, such a over dramatized representation.
Definitely. So let's see here, just a few more. This next question is, what steps can individuals take if they suspect they or someone else is having a heart attack, and how does that differ from what's shown on screen?
Yeah, that's a great question. The number one thing is to call 911. Because they will walk you through the next steps and they will also get someone to you that has the right medicines and all of that important stuff. I practice in Minnesota and I've had several patients who were way up north at their cabin and drove themselves to the emergency room when they thought they were having a heart attack. It is an important thing to remember to try not to do that because those are the times you're putting other people at risk too if you do have that, cardiac arrest with your heart attack. So call 911. And then the thing in film that doesn't happen is CPR. And I think it's something important to talk about, when there is a cardiac arrest and someone goes down, checking pulses and CPR is so important. Calling 911 is the first important thing, and they'll walk you through that too. But remembering the importance of CPR is so important. Not
Yeah.
often shown in film, interestingly.
Yeah, that is interesting. And thank you very much for that insight. So let's see here. The next question is, what can healthcare professionals and advocates do to counteract the myths perpetuated by film and improve public understanding of heart attack risks and symptoms?
Yeah, that's also such a great question. I think it comes down to community public education and outreach. Things like this are amazing. Anytime we can get our health systems or our physician providers to do community outreach, community education, I think that's so powerful. I think the one thing we have room to improve on in healthcare is more of the fighting fire with fire from the standpoint of social media, because there is so much misinformation on social media, and people can post anything as truth, even if it's not. And this can get folks into trouble sometimes. So I think as healthcare providers and health professionals and health systems, working to get our social media presence stronger would be amazing, to have engaging, accurate, evidence-based resources available for patients, just more of that. But providers and healthcare folks are pulled in so many different directions. I think it's just lower on the priority list right now. But
Yeah. Yeah, great points and totally agree. So, do you plan on doing any further research in this area? If so, what specifically?
yeah, we've got a couple different things going. A couple more stuff with the mortality data, and some TV stuff as well. There's just so many different directions, and there's been so many interests in collaborating. So we've got a couple fun things coming up. Um, and the thing I do like about this area of research so much is that I can show these papers to my patients and talk about them with my patients, and everyone can understand these graphs and these papers, and it's a strong education point, and I think makes a memorable impression on an important health lesson. And so it's been so fun to really involve my patients in this process too.
Yeah, absolutely. And is there anything else you'd like to say to our audience before we sign off?
No, I think thank you so much for listening, and was so happy to be here. Thanks, John.
Yeah, absolutely. So that's all the time that we have for today, folks. A big thank you again to Dr. Shaw for presenting on this excellent topic, and thank you to all of our attendees who joined us this afternoon. We appreciate your participation. Before we sign off, I just wanted to mention that our next On the Pulse session is scheduled for Wednesday, June 25th, and that will feature Dr. Joellen Moore, who's going to be presenting on atrial fibrillation, key insights into diagnosis and treatment. And we can add a link to the chat pod now, which you may use to register, and we hope to see you there. So thank you, everyone, and have a great rest of your day. Thank you.